My name is Saad Zubair, and I'll be your host today. Co-hosting today's talk is Nadia Rahman, Communications Specialist in the Office of Dean of Students. I'd like to take a few moments to go over some basic guidelines for this session. We ask that you please mute your microphone and turn off your video to conserve bandwidth. If you have issues in listening to the audio, please try with headphones. For audio or any other issues, please send a message on the public chat or to myself or Nadia individually. This session will consist of a short talk that is 15 to 20 minutes, followed by a moderated question and answer segment for a maximum duration of 30 to 40 minutes, and the total duration for the session will be 1 hour. If you have any questions or comments, please write them in the public Zoom group chat. We recommend sharing questions in the public chat so that others can see your questions and gain inspiration from them. Time permitting, I will ask Dr. Sarfaraz questions based on the order in which they were received and their relevance to the topic. So coming to today's topic. Today's talk on the COVID-19 National Action Plan is by Dr. Shabnum Sarfaraz, Member, Social Sector and Devolution, and lead of the National COVID-19 Secretariat under the Planning Commission of the Government of Pakistan. Dr. Sarfaraz is also a Women in Global Health Lead Fellow at the Harvard Global Health Institute and is a visiting scientist at the T.H. Chan School of Public Health at Harvard University. With over 20 years of experience in the development sector, Dr. Sarfaraz has worked with political, bureaucratic, and technocratic leadership, academia and senior research professionals, bilateral and multilateral agencies, private and the nonprofit sector. And her areas of interest are designing and executing large and complex systems and policy interventions, and her pioneering work on human resource for health has been recognized by the WHO as a model for the region to replicate. Dr. Shabnum Sarfaraz, thank you for taking the time out of what must be an extremely busy schedule to join us today. We normally begin our talks with a message from our Dean of Students, Dr. Aisha Mia, but seeing as she has been called away urgently, I will turn over to you, Dr. Sarfaraz, and ask you to take your presentation away. Thank you.
Thank you so much. Thank you. It's a great honor being here and being able to speak on behalf of the government. And I welcome the opportunity to answer some of the questions which keep coming to me on LinkedIn, on several social media sites. So I do commit to answer all that I have knowledge of today. And for the remaining, I would ask my team to respond back, and they'll take a note of all the questions that you'll put forward. So I'll just start. I've put some slides together, and these are the slides which I had been using to inform at different policy forums at the Planning Commission about how the government is responding to the COVID response. So I'll just put up my slides and we can take it off from there. The topic that I had decided with AKU to talk about is on the COVID-19 National Action Plan and how the government is facilitating a participatory response. For some of you, I just thought that there may be some international audience. So we are a country of over 220 million population. And we are spread, we are geographically divided into 6 provinces. The Planning Commission, where I work, and I head the portfolios for the complete social sector spectrum, which includes health, population, education, social welfare, SDGs, manpower, and youth affairs. So the Planning Commission has a unique convening power. Most of you would be knowing that a lot of subjects devolved after the 2010 devolution, and health being one of them. And the Planning Commission still retains the power, the convening power, despite the devolution. And for any cross-sectoral, multi-sectoral sort of responses, which required a lot of ministries, a lot public, private sector, civil society to step forward. So that is the unique positioning that the Planning Commission has, and whereby we interact very closely with the federal ministry, who are expected to be coordinating with their provincial line departments in the provinces. So they bring the feedbacks to us, but we also reach out to the provinces directly as well as we operate. So the Planning Commission is the apex planning and coordination body of the Government of Pakistan, which the chairman being the Prime Minister, and then we have the Deputy Chairman, Mr. Jahazeb Khan, and we have 6 members, out of which I am one, and we are holding our portfolios. And mine being the social sector is one of the most challenging portfolio that I think my other colleagues are not very keen to have this portfolio at the moment. But we all know that it's not only the social sector. With this COVID-19, it has impacted, initially when it started, a lot of people around the ministries had the focus on health, but as it unfolded, there's nothing under the sky which has not been impacted by this. The Planning Commission is actively coordinating with the federal ministries and the provincial governments in putting together the response, and also not only facilitating a participatory national response, but also looking at where we need to build capacities and resilience. So there was a national coordination committee which was notified on the 14th of March, and that is again headed by the Prime Minister. And a sub-committee of the National Coordination Committee has its secretariat at the Planning Commission, and this is where one of my colleagues who's leading this subcommittee to the National Coordination Committee is coordinating with all the ministries on a daily basis, and they report their economic impact, and the mitigating measures that they feel that they need to take in place or they have taken into place. So we are not only analyzing the economic impact analysis being suffered by them, but also are required to evaluate the mitigating measures that are being proposed, and also some of the decisions which are being taken by the NCC. So they are also being evaluated by this subcommittee. Alongside, it was felt that we needed to, like all other countries, that there was a need for a comprehensive socio-economic impact analysis. And for this, we were supported by the UN partners, and we established the COVID-19 Secretariat. And with the support of UN, we started off with a comprehensive socio-economic impact of the vulnerable population who are most at risk of COVID-19. And as we started working on this, the first draft of this socio-economic impact assessment was done, and it was placed before the National Coordination Committee on the 9th of April, alongside the economic impact analysis done by the subcommittee to the NCC, and they both are expected to feed into the National Action Plan for COVID-19 as we work together very closely with the ministries, the provinces, and this is expected to serve as the roadmap to addressing vulnerable and affected segments, the sectors, especially in wake of COVID-19. We expect this plan to be of 2 years, and it's still evolving, and we are trying to put it into place with a lot of support of a lot of technical experts who have stepped forward, both nationally and internationally, to help us realign and restructure our priorities as we move forward. The COVID-19 Secretariat, this is something when I look at, there are few things which have happened during the course of these 4 weeks that I had been working on, and those were my aspiration really. But in these 4 weeks, we were able to put together certain structures which look very close to the way we had conceptualized moving forward, setting up some systems, bringing in some technical capacities. So what you see over here is the structure of the COVID-19 Secretariat, which was put together with support of UNDP, and it was the first weekend after the COVID outbreak. I think our numbers were just in less than 100 at that time. And over the weekend, we sat down to do the TORs, and we went ahead and reached out to some technical resources. And it was heartening that people stepped forward. People who were not working, they came forward, and those who were working, and I reached out to, and the other UN partners reached out to, they came in as volunteer, and I would say that I don't see a difference, at this point in time, when we are working at this COVID-19 Secretariat, trying to organize the socio-economic impact assessment and the mitigating measures that are in consultation with the provinces. The main focus of the socio-economic impact was on the social vulnerabilities, was on the livelihoods, how to secure the food and the nutrition supplies. There was a great focus on the women, girls, and transgender, on the reproductive health care and newborn needs, and also for the overall coordination and the economic vulnerabilities. So I again see this as something, that we had all been talking about, advocating for, an equal world, really. So now that, the socio-economic impact assessment was happening, and we were looking at it with the lens to ensure that the vulnerable populations are integrated into all what we do through these plans and through the resources that have been mobilized. So we kept on adding more and more UN partners, multilaterals, bilaterals, and there were commitments were in place. And alongside, we were working with the ministries and thereon with the provincial departments, so that we are able to provide them with the support which is aligned to their contextual need. So as we were reviewing the drafts which were coming to us from the ministries for the economic impact that they had suffered, and also from the UN partners for the socio-economic impact assessment they were doing, we felt the need of, building up our technical capacity further to have these. And that was the time that we reached out to a number of national and international institutions who actually were there, and they had been asking us where they may support us, and a lot of them supported us in the reviews that happened over a period of, I think, 4 to 5 days, that we were working day and night to put it together. So this is how the structure of the plan, where the COVID-19 Secretariat is within the Planning Commission. It is working very closely with the subcommittee of the National Coordination Committee, which is coordinating with the ministries for the economic impact analysis. The COVID-19 Secretariat is already now moving towards establishing a strategic intelligence hub. I'll be showing you another slide how the structure is evolving as we are aligning our technical needs, and as we are moving forward. And what is expected of the COVID-19 Secretariat is to measure the economic impact of sectors, population, and institution, and help develop sectoral mitigation strategies and framework. And this is all being done at the moment with a lot of consultation and participation of both public, private sector expertise, and also of the academia. So why did we need to establish the COVID-19 Secretariat? Because of the socio-economic impact assessment, we felt that there was a need to have a conduit between the government and the UN partners, other donors and development agencies, and now I would say research, academia, and the expertise which is out there, and to help us effectively coordinating their support for the COVID-19 national response. So the Secretariat is at the moment providing critical technical backstopping with the support of all that I have listed before to the Planning Commission for its evolving needs. And that is why from the COVID Secretariat, it was within the first week, 10 days, we realized that our need is going to be long term. It will go beyond the socio-economic impact assessment. And we started working on the concept of the strategic intelligence hub, where I really hope that a lot of you would, it will provide a platform for people with different expertise from different disciplines to come and work with us and help us with the COVID-19 response as we move forward, because this is something which is critical for us to benefit from the expertise which is available with the institutions which are already there. The COVID, all the slides that I'm just going to be showing you, the data and some analytics that we were doing and are continuing to do to support decision making. So every slide that is in this presentation is done by the COVID-19 Secretariat together with support of the government departments. And so that capacity is built in, and this is great to have, those analysis happening alongside that. We are sitting in the meetings and try to see the different pictures while evaluating the mitigation measures which are under review. So this is going to be a very, very important function of doing these rapid critical insight for use in corrective policy and program design, maintaining an updated repository, again arranging for national and international expertise to help strengthen design, because a lot of people were reaching me, my inbox was flooded, and now having 3-4 people initially at the COVID-19 Secretariat, and then soon we realized that they were hardly sleeping. Then we decided on the focal areas, and now we are establishing these hubs where the different expertise, we will be able to link them with the relevant expertise and to the relevant ministries, and to help utilize their technical expertise that can come in our way for designing these interventions and as we move forward. So the COVID-19 Secretariat, together with the expertise which will be accessible to them through these institutions, will facilitate designing of evidence-informed interventions. We are already working on strengthening our monitoring mechanisms to allow for effective coordination and implementation of the response intervention. This is both in terms of the procurement, or in terms of the operations, because it is a large-scale response effort, and in which a lot of resources are going in. Because there's, as I'll be showing you as we move forward, there has been a national response, and we approved some national budgets. So it is important to have these effective monitoring mechanism for these supplies and equipments and other procurements to reach to the provinces. The COVID-19 Secretariat is also expected to generate communication tools and requisite policy briefs. And this is not health, this is all sectors and all disciplines really. And this is where I would strongly encourage some of you who are interested to reach out to them, and we are trying to formalize. And this is a structure which is here to stay. And after COVID-19, I think within the next few weeks, we will be replacing this with a strategic intelligence hub. So as the epidemic, it was on, Planning Commission is often, criticized for holding files for years and for, taking its time for reviewing proposals and all that. But the sort of response that we saw, and the sort of, how the government acted, it was phenomenal. It's really moving, and it was a participatory review process. We couldn't have done it alone. So when we received these proposals and we received the socio-economic impact assessment, as I told you, the COVID-19 Secretariat was set up just within 2 days. The sectors were assigned to the relevant partners on the 25th of March. We had regular meetings with them, and the first draft was received on the 5th of April. During this time, until the time that we had submitted it to the National Coordination Committee, the first level review was done by the relevant sections, ministries, at the the sections at the Planning Commission. The second level of review was done by the COVID Secretariat, with support a lot of national and international experts and institutions. And this is how together we were able to have the first socio-economic impact assessment report in place. And this is helping us in defining our priorities for national and international assistance, which will be required as we move forward. So now this is the sort of shape that the COVID-19 Secretariat just in 2 weeks has started taking. So we are, for the different sectors that we are catering to, we are looking at what donors will be working in there, and we are going to be appointing focal points, and we are in the process of formalizing this structure. And I think this will play a key role as we move forward into designing and also overseeing the implementation and monitoring of the response activity. Again, as I said, that it was over a period of just 3 days, and a lot of, I would really want to place a lot of my appreciation to the entire team which worked with me as we received the concept on the 16th of March from the health, education, and for the social welfare. There were 3 components of the emergency response to COVID-19 pandemic, and it was on March 18th we had a few more observations to be settled, and on March 19th, within 3 days, with a lot of consultation, in-depth reviews, day and night, supported by the development partners, supported by experts all across. There were, I think there are few people I reached out to. It was a weekend, and I reached out to them to get different pieces of the concept proposal reviewed, and there was nobody who didn't just responded back in hours. So we were able to put this together and have it technically vetted. And the first emergency response to the COVID-19 pandemic was supported by World Bank with an amount of 238 million, and the Asian Development Bank also provided $350 million. So overall, we had $588 million approved by the 19th of March, and this included a health component of $366 million, which was put together in consultation with the provinces by the Ministry of National Health Services, Regulation and Coordination, and it was supported by they were supported by WHO, NIH, HSA, and so many other institutions as they were working on this concept proposal. The Education Ministry, because we have about 50 million students who went out of school, the education was disrupted, and there was $100 million which went to the education, and $217 million were given to the for the social welfare component. This was from the initial $588 million approval, which was given to the National Emergency Preparedness and Response Plan. I think there was, I've listed just a few of, the ministries and government structures who are continuing to work day and night, but I think every ministry, whenever called up, nobody looked at the day, what time of the day it was, and it's only together that we were able to, reach out to where we are. We have to remember, that we are not a country, we are a developing country. We have limited resources. Our institutional setups are not very strong. And with such a crisis, which is a global pandemic, a national response was needed, and everybody needed to step forward. So where we are today, and if the things are a little contained, I would say that it is because of the way everybody was working together, and people stepped forward from all walks of life for this response, which is in there, where a lot of individual efforts are also involved. So primarily it was the Ministry of National Health Services, Regulation and Coordination, and which again there was NIH is playing, National Institute of Health is playing a very key role in here with their disease surveillance and response efforts, and also being the central reference lab. They constituted a number of labs in other provinces and trained their staff, and they're providing them with the equipment and supplies, and that's why you see our capacity being built up for testing the COVID patients. NDMA playing a very key role in procurement of supplies and equipments, and working day in and day out. They've been able to put their first report, which was released by the Ministry of Foreign Affairs, and I will provide you links to the reports which are already there. A Health Services Academy, together with other academic institutions, a lot of subject matter experts joined them, and they are putting together guidelines, resources, and toolkits. They are in touch with NIH and Health Services Academy. They are working with the London School of Hygiene and several other international institutions. I don't want to take the name of the institutions because there are too many, and it's really heartening that how people have joined hand. CDC China, their team has been here, and they've been guiding us and providing on-site support to a lot of health professionals. You're already aware, must be aware of the SARS program, the Socio-economic relief package, which was announced, and the disbursements are in process. I think one of the things that I really take pride in is the Tele-School channel, which was launched within, I think, 3 weeks of when we closed down on the schools. And I see it as an opportunity for us, you know, that we had so many children out of school, and we used to worry, and we used to think that how every year we wanted to come up with new programs, new plans. But I feel that this is going to be an opportunity for us to provide not only access to the students whose education has been disrupted and they are not going to school at the moment, but some of these interventions will help us reach out to those students who never went to school, and particularly girls. So the Ministry of Federal Education, together with the provincial education departments, is working on a number of e-tech and tele and using other mediums like radio and all, and coming up with packages. And we are receiving very good feedback on the Tele-School channel, which has been launched. The National Command and Control Center was set up, and which is headed by my minister at the Planning Commission, together with the Minister at the National Health Services Regulation and Coordination, and it is reviewing a lot of data which is coming in, and it's for technocrats like us, it is heartening to see, you know, that how data is being utilized, how they are welcoming evaluation of the decisions that they are taking and the impact that it is creating, and they are open to, you know, reviewing and revising their approach. So the entire chronology of events is being monitored and is being tracked. So the slides that I'm just going to quickly pass you through is just to give you an idea of how the government has built up their capacity, and how because when I also used to work for the private sector, one of the criticism which used to be in there was that the decisions are made on an ad hoc basis. So even in this war time, you know, in this crisis situation, a lot of evidence is being fed into it, which you can see. I mean, there were, for the travel advisories, a lot was studied in, and for the lockdowns, how the quarantine facility arrangement should be, how the flights should be scheduled in line with our capacities, and different economic analysis which are coming our way. We are also looking at, continue to look at, you know, what is shared with us by the private sector in terms of their analytics. And we are conscious of the impact that it has had on all the 17 SDGs. And we are working with the relevant ministries now to put together their annual plans for addressing the disruption which has been caused in there. Again, hydroxychloroquine, this was brought up, and this was also discussed in there, and we are continuing to keep our watch on the different trials and the results which are coming in there. The dashboards are shared according to the need of the policymakers, the decision makers, as we continue to share this evidence on during the meetings and try to evaluate the different mitigating measures. So I'm just going to quickly pass you through these just to give you an idea. And as I said that, I mean, look where Pakistan was, Pakistan was here when the joint external evaluation was done, and US was here and UK was here, and this particular pandemic, for our preparedness for such epidemics. So no country was truly prepared for something as this is truly unprecedented. So even the top ranking countries like US, UK, they suffered so badly due to delayed political decision making. And some of the countries who are in the lower, ranking, they fared pretty well. So again, I mean, I don't need to go through these, but we will be happy to share them with anybody who's interested. And actually, they are on our LinkedIn. You can see it. My idea of showing all these is that we did continue to do analysis and to review these analytics as we were making our plans and trying to keep our watch onto how the epidemic is unfolding. Doing our analysis, geographic analysis, and also to see that where we may need to build increase our capacities. So where we stand today is that we are. I'm sharing with you on the screen. You can see the 3 goals that we have set up for the National Action Plan for COVID-19. The first goal being saving lives, which includes suppressing the transmission and also strengthening the resilience of the health system for similar epidemics in the future. The second very important goal is saving livelihoods to address the differential impact and expanding the scope and reach of social protection and salvaging the economy. That is reorienting to evolving landscape and also exploiting some of the favorable externalities which are in there. I wouldn't go through the details of the different interventions which we keep on populating them, and I had listed some of the key ones which are there, and because I would want to take some questions, and I think I've taken quite a bit of the time. One thing that I really want to say over here is that this crisis has really challenged the custom norms, and I see that even in our ministry, in the bureaucracy, that the previous ways of working have really it has forced us to rethink our existing paradigm, and we feel that we need to reorient our development priorities and also identify how the world is evolving and learn from them, as some of them are ahead of the epidemic than we are. We are wary that we need to redesign our sectoral strategies. And one thing is for sure, that ICT is going to be the thing forward. And in every sector and in every disrupted, we feel that ICT is going to help us revive. We are continually, there is a need to continually review the global best practices. And as I said, that there's no sector and no segment which is not affected by it. How the government is taking it is that yes, it is tough, but we do feel that this crisis can be turned into an opportunity. It provides us with an opportunity to carefully work and redefine our mandates, our development priorities, and align our federal policies to facilitate the provincial interventions. And I think that facilitating a participatory national response in close coordination with the provinces is something which is going to help us as we move forward in not only addressing the epidemic, but also building our capacities and also for reviving for the revival phase that we would be entering on to. So I think with this, I would stop, and I would just say that the coronavirus has touched every aspect of our lives, and we know that we may not be, things may not turn to normal for quite some time. But it does give us an opportunity to work towards a more equal Pakistan, I strongly feel, because as we will be doing these interventions and looking at the marginalized and setting up some systems, I feel that this is something that there is some positivity that we feel maybe would be coming out of it. And that is where we need a lot of technical resources joining us and building our capacity, because the government has a scale which is not matchable. So these technical expertise which come our way and who have piloted certain things, the government should be able to scale it up and to be able to provide resources for the same. So I would encourage you all to keep in touch with, there is a Yane Watan initiative which has been launched. There are different elements that we would want to look at, mental health, which we wanted to do for such a long time. So do reach to them and do reach to the COVID Secretariat. And as we move forward, we hope to engage a lot of you, and in a very in taking a much more effective response and revival as we move forward. Thank you so much. Thank you.
Thank you very much, Dr. Sarfaraz. We've received a number of questions. Of course, this is perhaps one of the most fascinating topics that we've been able to have a speaker discuss during our short series thus far. So the first question that, which I'll jump right into, given that we don't have a lot of time, is by someone by the name of SS. In your opinion, what is the future outlook of COVID-19 as it is judged by the NCC?
I think nobody can give a certain answer to that, the future, what I can say is that things would not be the way they are. I don't see things going back to normal for years. And I think that's something that is being forecasted even internationally, what I am saying in here. It's going to be tough. Certainly very tough at the moment. The repercussions are not being experienced, which as we move forward, those are going to be evident. But again, as I said, that if we are able to do our pick up our strategies smartly, and we are able to do our with the limited resources that we have, and we are able to put essential systems and structures in place, we may be able to limit the damage which is occurring at the moment.
Thank you for that. Our next question is by Dr. Zulfikar Bhutta. He asks, how is the impact on reproductive, maternal, and child health indicators being tracked, given that we are largely dependent upon periodic surveys to get household level coverage? What about nutrition indicators for women and children and immunization coverage? So that is reproductive maternal health indicators, the tracking, and what about nutrition indicators for women and children?
This is extremely important. I think this is something that just before this presentation, I was in a review meeting with the Ministry of National Health Services. We do our quarterly reviews with them, and what was being emphasized to them by the Planning Commission was to ensure continuity of services and trying to, because initially I think everybody had the same sort of feeling that, okay, let's first deal with it and then we'll go back to putting things, getting them into the same order as it was. But even today, we had talked about immunization. We've talked about the procurement cycles. We've talked about how this is certainly a priority for us, that the immunization stays on track. And this was discussed today as a priority agenda in the review meeting. We are working on with the provincial secretaries of the population welfare departments, as well as with a large group of experts on family planning, reproductive health, and maternal and child health. And a lot was disrupted. And again, there are going to be, we will see the impact of that in the coming months. But yes, the intention is very much so, and the socio-economic impact assessment, which was done, has a huge focus on children, on maternal health and reproductive health. So that is going to be the foundation document, which will lead to the development of the national COVID plan, and we are ensuring that these elements are part of that, and also part of the funding and the restructuring of the government funds, so that these services, we are trying to support the continuity of these services, and also money injected into it to help strengthen the systems which are offering it.
Thank you. Our next question by Huma Rashid. She asks, what precautionary measures are being taken to avoid COVID-19 by the Secretariat, in the sense of what treatment strategies have been taken to flatten the curve? Sorry, Dr. Sarfaraz, are you there?
Yeah, I'm there, but I couldn't hear you. There was some interruption.
Sure. I'll just repeat it. Our next question is by Huma Rashid. She asks, what precautionary measures are being taken to avoid COVID-19 by the Secretariat, and what treatment or other strategies have been implemented to flatten the curve? Dr. Sarfaraz, are you there? We're not able to hear you. Just one moment, please. Should be going off mute right now. Yes, there we are.
Is it working now? Can you hear me?
Yes, we can hear you.
Okay, because you needed to unmute, I couldn't unmute myself. So could you just repeat the question?
Certainly. What precautionary measures are being taken to avoid COVID-19 by the Secretariat, and what treatment or other strategies have been implemented to flatten the curve?
One of the things that is being still debated is the hydroxychloroquine, but they are keeping a close watch on the trials, as I mentioned, on that, and there are certain although they have included it in the guideline, and I had shown you one slide showing that, and these guidelines are available if you want to have details of the treatment strategies. On my last slide I will be sharing my presentation, and on the last slide there are links which will lead you to where the national guidelines are there, and there are treatment guidelines in there. And but still there is a very cautious use, and which is there. And as far as the precautions are concerned, I think we went on to, there's a lot of remote working, which is again a very big change for the ministries to, I hadn't seen that much of remote working happening, which has become a norm, and now, so that is reducing the a number of people who are having to attend the offices, and also if it is particularly to the Secretariat, for the Secretariat staff, then I would say, and the regular measures which are in there, but I think that is something which we are following as for the offices, as advised by the WHO, guidelines, and also by the national guidelines for offices, and all that's what is being practiced.
Thank you. The next question by Ahvaz. He asks, an effective participatory response also involves the public. What have been the strategies for political engagement and communicating strategies with the public at large?
There have been, I wouldn't say that there are certain even surveys which we have started off to get the inputs of the people, just to say, for the tele education, the tele channel, which has it's been weeks that it has been launched, but they've already started a survey onto that. There are certain, applications which we are monitoring the data on. The helpline, their data is being evaluated, and that's the public sort of response, that we are able to evaluate that what sort of information is available to them, people to reach, even administrators, meeting people and getting their, feedbacks onto the services which are being provided. And also, so I think there is, of course, there is a certain disruption into the normal sort of, public engagement that one could have in these lockdowns and all. But I think these ICT-based channels are pretty much open, and these are certainly being reviewed. And I mean, like the sort of responses that we get from everybody, there's a dashboard which is being maintained, and we continuously monitor it for the feedbacks that we are receiving, and try to take it into account as we sit down in our meetings. So yes, not in a formal way, but in many informal ways, this is happening.
Right. Thank you. The next question by Mahmood Virani. He asks, what are your thoughts on a lockdown versus the herd immunity approach that a country like Sweden is using, especially in a country where social distancing is not very practical in many areas, where people live in densely populated areas with no practical means of staying locked up inside?
Personally, I mean, this is very tricky, because even yesterday I was reading, a research paper which was talking about India having a lot of young population, and for them that this could work, which puts us almost in a similar situation. But then we have countries like UK, for whom it backfired. So there has to be a very cautious approach, towards that. At this point in time, every day, we learn about something new, and the next day, there's something which is, contradicting that. So it is again, I mean, we always talk about, evidence guiding us in our decision making. But here we are all, in taking our decisions in the apps with the evidence about which we are not sure, because it is there, but nobody's, there isn't enough substantial data to take for any matter. You talk about treatments, you talk about, any sort of intervention, like, I mean, even for the herd immunity or anything of the sort. So this, I mean, I always used to talk about, this disconnect that we have between intelligentsia and the policy and decision makers. But now, we are all in this very strange situation where there is the evidence is, evolving every day, and it is based on, what is available that day that we are trying to, interpret the situation. Very fluid it's going to be, and very and that is why we feel that we need to have these analytic capacities in place, and as I said in one of my slides, that looking at the countries, how it is evolving, and how the different countries who are ahead of us or who are in a similar situation, and learning from them. So it's a continuous learning and a continuous analysis on a daily basis, I would say, as we are moving forward. We just can't sit back. So we are looking, and whatever it comes our way, we try to widely disseminate it to help, the provinces try to look at those data and guide them with their as they're moving ahead. But nothing is for sure, nothing for any matter, I would say. We have to keep our eyes and ears open and continuously evaluate the situation.
Thank you. I think that's an excellent principle for such an uncertain time. Our next question from Sana Siddiqui. She asks, has there been any gender difference seen in the data collected by the Planning Commission, and how have we responded to it?
There is a very interesting, slide that I had actually put in yesterday, because we did the gender analysis. And initially when we did it, we saw that, the females were less affected. And now that we've done we did a repeat of repeat analysis yesterday, where we analyzed the confirmed cases, the deaths, and by gender and by age group. And it was a little alarming to note that whereas the incidence is much, much higher in males in Pakistan, there is, over these 10 days, what we have seen is that the incidence of deaths in 80 plus has risen to 73%. And in 10 days back, it was around 23% or so. And in 70 plus is now around 36% death rate in males, whereas it was 12%. So this is much higher than the global average that we have, and it is alarming, and we are looking into. We shared it with the concerned ministries and also with the certain private sector institutions, and I think this needs to be looked at. But we do understand that there are comorbidities, but this is a very high rate of death that we are seeing against the global picture that we see for males and also for the higher age groups.
Thank you. Our next question turns to issues of mental health, and this is a combined question asked differently by two people, Fatma and Dr. Murad. How is mental health being addressed in the population? What about data collection on mental health and those affected by COVID?
Mental health has been an issue that I was guilty of, even before that. This is something that we really need to set up in a much more formal way, and we need to have institutions, and we need to really build on the and I was alarmed by the high suicidal rate and the drug addiction, and all these anxiety disorders which are at the back of it. And we were thinking of putting something together for taking an institutionalized response to that. And now with COVID-19, this is again, it's a strange situation, because everybody is going through a personal crisis together with what is happening at a national and global level. So this is going to have very huge mental health implications, and this is the time more than ever for us to put our efforts together to take an institutionalized response, to build up sustainable structures, work on policies. And my team at the Planning Commission would really welcome such opportunity of working with experts into putting this very much needed structure and system and into place, the guidelines, and also building up certain programs around it. And I would welcome this opportunity. This is definitely on the cards, has been on the cards for some time, but now it's a dire thing to do, and it's certainly a priority. But we would need some expertise coming from the private sector, and we would be very keen to work on this one.
Thank you very much.